Good afternoon. I'm Dr. Deuk, CEO and founder of Deuk Spine Institute. It's September 19, 2024, and we have Boney M in the operating room with us, playing Rasputin in the background. We'll be performing on this patient from New Jersey, bilateral L3-4-4-5-5-1 facet joint Deuk plasma rhizotomy for facet joint pain. Then we're going to go down and do bilateral SI joints. We'll do a separate stream. But we're going to start by basically destroying pain nerves that are causing chronic back pain for him. All right, we're going to get started. Incision. The incision is 4 millimeters. We put the incision on the side that we're working on. So if it's left-sided pain from the facets, the incision is going to be on the left. If it's right-sided pain, the incision's on the right side. You remember now, huh, Berndes?
Yes.
Rasputin. For all you disco fanatics out there, 1982, we're playing Boney M. Shot?
I don't think Henry was born.
Henry, were you born in 1982?
No. No.
That's what Berndes said. He said, I don't think Henry was even born.
I'm 98.
Shot? Wow. So we'll be going up to number 3 first, and we're targeting the transverse process where it joins with the facet, superior articular process. See where the tip is? We are in the most perfect spot right there. A little bit deeper. If you have questions, feel free to ask me. So the medial branch of the dorsal ramus exists coming out of the foramen, and it travels over the transverse process between the transverse process shot and the superior articular process, which is exactly where my show us the TP, show us the superior articular process. There's the TP. You can turn it off. All right, otherwise it'll just repeat. There's the SAP or superior articular process. Show us the tip of the probe right there. Perfect. So 1 nerve down, 5 more to go. If you have questions, feel free to ask. Henry will direct them to me.
Of course.
In the meantime, while we're waiting for questions from our audience, let's show people how do lumbar facet joints cause so much pain. What's the mechanism?
Copy that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website.
Well, we apologize with the confusion there, but we started with discogenic pain and transitioned to facetogenic pain. But basically, this patient has pain coming from the facet joints. You could see, hopefully from the animation, how that injury to the facet joint leads to chronic pain. And now, Henry, let's show the audience how the Deuk plasma rhizotomy works to eliminate facet pain.
Of course.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
You've seen how we treat facet joint pain at Deuk Spine Institute with the new state-of-the-art treatment that we pioneered here. It's called the Deuk plasma rhizotomy. I've just finished cutting the pain nerves at L3, L4, L5 transverse process, and now we're going to do what's called the L5 dorsal ramus. You could see on that x-ray, Jordan, show him the tip of my probe. It is literally perfect exactly where that pain nerve comes out and travels to innervate the facet joint. So any questions from the audience? Sean?
At this moment, no current questions.
Yeah, that is literally textbook perfect positioning of the probe. It doesn't get better than that. I can feel the superior articular process of S1. I can feel it right there. So I'm right up against its lateral border. Perfect. Now I'm going to move on to the right side. And the right side also needs to be treated because he has bilateral symptoms. Shot. Very good. That's a perfect entry point. These incisions are 4 millimeters each. Henry, since we've got a few more minutes to go on this procedure, why don't we show the audience all the different causes of back pain?
Of course.
What are the 30? There are 30 of them, folks. 30. And every one of those causes is not equally common, okay? Some are far more common than others. Let's show the audience the 30 causes of chronic back pain so they can understand a little bit more about those causes and how to fix them.
Of course.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. Welcome back. You can see there are roughly 30 causes of chronic debilitating back pain, and the facet joints, which is what we're treating here, is one of the most common causes. Shot. Another common cause that we'll be treating next is the sacroiliac joint, which is what we're treating next on him. Now, he traveled here from New Jersey, and he told me he was voting for Trump, so we decided to treat him. Just kidding. We have an election in how many days? 48 days, something like that. So I had to make at least one election joke. Shot? All right. If you're watching and you have a question, feel free to ask. Happy to take it. Shot?
At this moment, no current questions.
We are just about done. We're going to wrap this up and we're going to move on to the sacroiliac joint. Okay, let me show you before we wrap it up what the incisions look like. Can you guys see this?
Yes, we can.
Now, the patient will be sore because we just went in there and did some stuff, but burning, and that burning will cause inflammation. But that's the size of the incision. It's quite literally 4 millimeters. And we did all the facets on one side and the other with that incision. All right, let's go ahead and end the broadcast. We'll be back shortly. We're going to be doing the SI joints next.
Copy that.